Hey everyone, Daniela here, and thank you for joining us for your weekly dose of inspiration, education, and encouragement. So, how many times have you wished that you could just melt the fat off of those stubborn areas on your body? I know I have, but it turns out that melting the fat is not the answer. It's actually freezing the fat that is the answer. So if you have not figured it out yet, today we are talking about CoolSculpting. And we have the lovely Nicole joining us to chat all about it. So Nicole, thank you so much for being here.
Thank you for having me.
So you've been doing CoolSculpting for quite a while now. How did you get into that? What's your background?
So I've been an esthetician for about 10 and a half years, and I'm actually recently at a newer practice here in the Massachusetts, Boston-based area. However, the practice that I initially started with, they were really at the forefront of getting the cool sculpting technology in. So CoolSculpting was FDA approved in September of 2010, and the office that I was previously at brought it in January of 2011. So I've been doing CoolSculpting for about 5.5 years
Right
at
from the
this
beginning.
point. Yes. And it has changed quite a bit at this point too. So it's really been exciting. It's one of my favorite treatments to provide for patients.
Very cool. So for the estheticians and aesthetic experts out there that may not be familiar with the treatment, can you give us a little background about what it is, how it works, and so on?
Absolutely. Absolutely. So, as I just mentioned, it is an FDA approved procedure. Again, going back to September of 2010. And just to give a little bit of background about how it began, there was two physicians, Dr. Anderson and Dr. Manstein, who are actually affiliated with Harvard University and Mass General Hospital here in Boston. And years ago, they had actually observed that children were having dimpling in their cheeks from eating popsicles. And this was actually known as popsicle panulitis. Excuse me, I can never pronounce this word correctly.
It's okay.
Okay.
Starts with popsicle.
Yes, so the popsicle paniculitis, excuse me, is this phenomenon. And they were actually, through then their research, able to pinpoint a precise amount of cooling to then contour the body. And so this is where the idea of cool sculpting or cryolipolysis, which is freezing the fat cells, really was born out of. So, coming into now this day and age, we are able to target the fat without harming any of the surrounding structures as well. And this actually will permanently reduce the fat cells in a targeted area. So your body
So
will.
you're actually like the cold will kill the fat cells at a different
Correct.
temperature than the actual healthy living tissue.
Exactly. So the skin needs really a more below freezing temperature than what is being applied with the cool sculpting. So the cool sculpting targets specifically those fat cells, which will go through apoptosis and a slow cell death to then gradually be eliminated from the body through a process called phagocytosis. So we have immune cells, which are called macrophages, or in other words that I describe to my patients are Pac-Man cells. So just like Pac-Man, they go through and eat up those now dead fat cells, sweeps it through the lymphatic system and out through the liver over the course of time. So,
What's that
um,
timeline look like typically?
describing to my patients, what I usually set for expectation is they will begin to notice in roughly a month.
Mm-hmm.
So about 3 to 4 weeks after their procedure, they'll begin to notice some of the changes, with full changes taking between 2 to 4 months after the procedure was done. And then in terms of expectations, you can get a reduction of approximately 20 to 25% of the area. So that will reduce the actual thickness of the fat by that 20 to 25% over time.
So tell me a little bit about the consultation process and how you go through patient selection.
Mm-hmm. So the patient selection is actually a very important part of the consultation process and really being able to find the right candidate for the procedure. The most ideal candidates are a body mass index, a BMI of 30 or below, or another way to put it is around 10 to 20 pounds of their ideal weight. And that is really going to help to target those stubborn pockets that are resistant to the diet and exercise. So, those people who are going to the gym 2 hours a day and trying to eat as clean as possible, they sometimes still have those resistant areas. So that's where CoolSculpting will come in. The other important factor into determining candidacy is making sure that it's subcutaneous fat and not visceral fat. So we know that subcutaneous fat is the type of fat that's on top of the muscle. It's that squeezable, pinchable fat. Visceral fat, which is underneath the muscle wall, typically in more of an abdomen area, cannot be treated because it's below the muscle. There's no way to target that. You can't target that via surgical liposuction either. So really just making sure that they have that pinchable fat of at least an inch or more, and that the skin with that fat is also going to draw into the applicator appropriately. So I actually have a couple of the templates here just to give an example. So this is the type of templates that we traditionally use for more of a debulking in the abdomen area. We have an example of a little bit smaller, more curved applicator, and this works more for the love handles. And then we have an example of this applicator, which is more straight across, which can target areas such as the inner thighs. And so those are just a couple of the examples, but there's different sizes of applicators. And for each of those, you're going to map out the targeted areas to see which applicator is going to fit best. And then again, pinching across the areas of interest to ensure it's going to draw appropriately into those applicators.
So you mentioned love handles, abdomen, thighs. Can you go through some of the areas that are actually FDA approved, the different treatment areas where you can do CoolSculpting?
Absolutely. So there are only particular areas that are FDA approved, which it actually started off with the love handles being the first one to be FDA approved. And then it graduated into the abdomen, the thighs, so both inner and outer thighs, the chin, submental area. And then as well as now, most recently, being FDA approved for the bra bulge, the upper back, and the banana roll, which is that area between the upper thigh to where it meets the buttocks.
Are there any off-label areas that this treatment's done on?
Yes, there are some areas that we have treated, such as the arms, the axillary pad, that area between the arm and the breast that we often get in shows and tank tops and bathing suits, as well as the inner knees. So the newest applicator for the double chin is the applicator that we can use in those areas. So it's really neat to see where CoolSculpting has started to where it's come now and where we're able to target.
They're calling that the Cool Mini, right? With the
Yes.
Yeah. Okay.
Yes.
Okay. Very cool.
Smaller applicator, really kind of niche areas that you can get.
Very cool. So for estheticians that might be interested in learning this treatment, obviously, it has to be performed at a medical spa or in a dermatology or plastics office. But tell me a little bit about what the learning curve was like. Was it a treatment that was challenging to learn, or were you able to pick it up fairly quickly?
A little bit of both. And what I mean by that is the technology behind it, as I was going through, is very straightforward. I mean, it really is applying the applicator and letting it do its thing. However, the learning curve really comes to choosing the right candidate. Again, going through that consultation process and ensuring that you have somebody that has that pinchable fat, that you're following the natural curves of that fat. So that is a little bit trickier than you would really think. You want to make sure that you're obviously providing the best results possible. So you really want to be familiar with the body and learning how to place those applicators appropriately. We do have in-office training. So CoolSculpting will, bring their representative in and really do a full day of training. But they also provide great resources on their website, which is called CoolNet. So once you're signed up as an account, you'll have access to this CoolNet, which has training videos and the clinical papers and so forth. So you can really have a vast array of learning tools from them, which is very helpful.
Oh, that is helpful. Because I know that sometimes when you first learn, they come in for the day of training or whatever it is, and it's easy with so many other things going on to forget about some of the details. So I love when they have those online portals for the training and everything.
Yes.
So tell me a little bit about contraindications and pre and post care.
Absolutely. So for pre-treatment, there's really nothing that you have to do. It is very straightforward. They come in, you may have them just wear comfortable clothing or have items at your office for them to change into, such as disposable underwear, disposable bra. In terms of contraindications, of course, very similar to other treatments, you can't treat those who are pregnant or lactating. And then really the only other specific contraindication is to treat anybody that has an allergy to cold. I won't even try to pronounce the two allergies, but there are two of them, and the CoolSculpting will give you the information. Zoltique will give you the names of those, but I will just not pronounce it correctly. So
I'm pretty sure I'm allergic to cold. I need to be in warm weather.
Well, yeah, I mean, I definitely have an allergy to cold in that sense. I love the sun, but you definitely don't want to apply this type of cold to anybody has a significant severe allergy. Exactly.
A legitimate cold allergy.
Exactly. There are some cautions to keep in mind as well. You don't want to treat in an area that has any compromise to the skin. So eczema, dermatitis, any type of open lesions where the applicator is going to be placed. Also, another caution is someone who has a hernia. If the hernia is within the treatment area, you definitely want to stay away from that. And then another caution, actually going back to the cold, is somebody who has a sensitivity, so such as someone with Raynaud's. You just want to have a conversation with them on the severity of their condition. I have treated someone with Raynaud's who had no issues whatsoever, but it is a conversation that you want to have with your potential client as well as your physician whomever you're working under, to make sure that they know of the condition, and just to have a conversation to make sure that they're comfortable with allowing you to treat that person as well.
Wonderful. Well, I think I asked everything. Is there anything else we missed that you wanted to add that you think would be beneficial for estheticians out there?
So actually, what I did miss on answering your question, I talked about pre-care, but was the post-care.
Okay.
Post-care wise, really the great thing about this procedure is that there isn't downtime. So people can go about their normal activities. They can go back to work, they can go to the gym, really without any disruption that a surgical procedure may have with restrictions to their lifestyle. There are some potential side effects, such as cramping, aching, tenderness to the area, bruising, where they may feel some discomfort, but would not put them out of commission for, again, their lifestyle activities. However, I do always go over those potential side effects with patients, just so they're aware, but they can go about normal activities. You may recommend having them wear some sort of compressive device if they so choose, for comfort level. It won't be anything that affects the results. It won't quicken the results, but just for their comfort to have some extra support. But other than that potential of having that compressive device or, garment on, then they can really go about their activities, which is just so awesome with this treatment. And that's
sounds
really
too good to be true.
I know, and that's why you've seen such an uprise in the popularity of this, is because they don't have to go through the planning process or getting somebody to drive them to or from, or being under some type of anesthesia. It is really straightforward and has awesome results. I love this treatment.
I remembered one more thing. What is the price point of this? I know obviously depending on the area, what's the range? Say something like a Cool Mini up to, I don't know, an abdomen area.
Right. So it does depend on the size of the applicator, and then therefore, as you mentioned, the number of areas that they're treating as well. So the base pricing for what we call the standard applicator, the ones that I mentioned for the love handles, or there's another size similar to this that can target areas such as the upper abdomen. That starts at about 750 to 800, depending on maybe what region that you're in, and then depending on the number of applicators, people will then discount from there. So then that can really range around 600 or more per applicator. So, I mean, I've treated someone who really has just had a very small pocket where we've done 2 of the standard applicators. So it comes out to about 1,500. And I've treated people who are more almost full body, and it's been into the tens of thousands as well. So it's really, again, just going through the priority of areas with your patient and developing that treatment plan. Because another great factor about this is that because it doesn't have any of the downtime, you can treat smaller areas and target where you want to, weeks at a time, months at a time, kind of coming back to where you want to treat, or you can treat everything all at once. So
So doing it all at once, though, I mean, you have to leave the applicator on for quite some time, right? Isn't it about an hour, or what's the?
Exactly. The applicator is on for an hour. So again, that's just going through with your patient of, do you want to treat multiple areas in one day? Do you want to come in a couple of days in a row? But yes, mapping out that treatment time. My office, we have 2 CoolSculpting machines. So we are able to provide something called dual sculpting, where we're treating, say, the love handles at the same time. So we have one hooked up to the right side, one hooked up to the left side.
Okay.
So that cuts the treatment time in half, but it depends on your office, how many machines that you have. But yes, that will dictate the number of hours that they'll spend with you.
Mm-hmm. Okay, very cool. Well, thank you so much. This has been a learning experience for me. I'm not trained personally in CoolSculpting, of actually knowing how to do it. I've been around it quite a bit and heard so many people say positive things about it. So I know that there's certainly an interest, and I think it's always great to expand our knowledge to the treatments that are actually out there. So thank you, thank you, thank you. And for all the other estheticians and aesthetic experts out there, if you do CoolSculpting, go ahead and leave a comment in the notes section so I can know what you think about this treatment and what your experience has been. So until next time, keep making the world a more beautiful place inside and out.